All right, so we're going to start with the HIV patho. Okay, it's quite complicated, so we're going to take a little trip. Okay, has anybody seen Ocean's 11 or Ocean's 12 or Ocean's 13? Oh, you must like that series. Has anybody seen? Do y'all know what I'm talking about? At least 11's the first one where they plan to break into the casino, right? Okay, so everybody knows what I'm talking about. Okay, so we all about to go break into a casino. Are you ready? Okay. What does HIV stand for? Immunodeficiency virus. Human immunodeficiency virus. All right, so we know it is a virus. We know it is a retrovirus. What does a retrovirus mean? It goes from RNA to DNA instead of DNA to RNA. Okay. But the DNA, remember, what was its job? Its only job is to have an idea. And then it tells the RNA to write it down, right? That's how normally things work. The DNA thinks a lot of itself, right? Okay, he's the big bad boss, and he's like, oh my God, write down everything I say because it is golden. And the RNA is like the little minion that has to do all the jobs, right? So in this case, we're like, you know what? We're tired of being treated like this. So we're going to go in there and we're going to pick up this DNA, okay? So we're all on a team together. Are y'all ready to go in with me? All right. So this is the cell that you're trying to infect. So this is our casino, and we got to get in undetected, okay? So you'll see those movies where like there's like a golden mask that they want to steal or something, and they have to go in and steal it and put something in its place. That's what we're going to do. Okay. But instead of a mask, it is a bag of diamonds. Okay. So that's what we're going to get. Are y'all ready? Okay. So step number 1, we need a plan. Do we not? I mean, we all just not going to walk into a casino and be like, well, we're going to rob you now. Right? We need a little plan. So let's plan. Okay. So the fusion of the HIV comes to the host cell surface. Now, if we're going to form a plan, we need to be outside the casino, right? I'm gonna look around, be like, let's see what this thing has, right? So step number 1, we're coming up to the edge of the casino, and we're just tourists. We put a camera around our neck and act like we're just, hanging out. Yes? Okay. So we're just on the outside. We haven't gone in yet. All right. What's step number 2? Somebody read it, because I don't have my glasses. Thank you. Oh, I did write that. I can read that part, but read the other part. HIV RNA. Okay. Mm-hmm. Integrase and other viral proteins enter the host cell. All right, this is where we're about to sneak in, and everybody here has a very specific job, and you're all good at something. Okay, so Deborah, you're reverse transcriptase. Honesty, you're integrase. Okay, you two are the other viral proteins. Y'all are gonna help us get out of here. Okay, so we all kind of get together. Everybody has their strength, right? I know you're good at sneaking in, and I know you're good at like distracting other people, so that you see what I'm saying? All right, we got our team. We ready to sneak in? Okay, so we went into the casino. All right, into step number 3. Somebody read step number 3. Oh. Viral DNA is formed by reverse transcription. What was transcription in genetics? What did that mean? No, that's translation. Sorry. Write it down. Okay, so transcription just means write it down. So viral DNA is formed by reverse transcription. So us as a team, we're like, okay, so we came up with the fake diamond bag, right? And we're like, we're going to go actually integrate this into the DNA so that we can swap out the actual diamonds, right? That's what we want to do. Yes? Okay. So we've created this plan. We created the fake bag of diamonds. We're in there. We're ready to go. You with me? Reverse transcription means we came up with the plan and put it in the DNA instead of the DNA having the plan and giving it to us. You with? All right, step number 4. It's time to make the switch. Oh, thank you. Maybe somebody else should do it. Just kidding. All right, so this is where y'all seen this in movies a million times. Somebody drops down from the ceiling, they grab it, and they replace it before the alarm goes off. That's what we just did, okay? So we've integrated our like infected bag of diamonds, and we took theirs. So we made the switch. You with? All right, step number 5. Somebody go. All right, so we put this jacked up diamonds in there, right? And it has little tracker devices in it. They thought that those are the real diamonds, so they start making copies of the real diamonds, but it has our trackers all over it, so we can find out where all these are. You with me? Okay, so this is where they replicated. Now they're making a whole bunch of diamonds, right? And now we're going to get all of those too, because we're going to keep hitting the different casinos. That's why there was an Oceans 12 and 13. Yeah? They wanted to hit the different ones. All right, so now we have the new viral RNA is in there, right? So ours got put in, and we took the real stuff. Yes? Okay, well, we did a real good job, but now we got to get out of here. Yeah? Okay, so we're going to go to the edge, number 6.
immature HIV form.
All right. So we just can't walk out with this big old giant ass bag of diamonds, right? Okay. So we're going to have to start dividing them out. Okay. I'm going to give you like 50 and I'm going to give you 50 and you 50 and you 50. Y'all start stuffing your pockets and stuffing your bras. You are not wearing one today. It is a boy that I said that to, just so you don't think I'm sexually harassing him. Okay. So we're going to start because we gotta get out of here somehow, right? So we're going to start separating it into smaller pieces so that we can all just sort of walk out. Remember at the end of Ocean's 11, they all just like walked out of the casino like nothing. Yeah, they were just like, sup, we're rich. All right, and then we go to number 7. What's number 7?
The virus is released and bioproteins leads new polyproteins to create mature infectious virus.
All right, so step number 7, we're gonna all like, oh hey, you go out the front, I'm going out the back. Are your pockets full? Are we good? Now there is something called protease. What did we say protease was? It's an enzyme and it's a chopper. Remember, we had that also in immune. It's a chopper. So we're going to break those diamonds into smaller pieces because we try to go sell those diamonds. They're going to know where they came from because they're very distinct, right? So we chop them into smaller pieces. And then each one of those teeny pieces of diamonds is going to go to a different casino, do the same thing over and over and over again. What is our goal? To hit every casino in the entire world until we have infected them all. That is HIV's goal. Do you understand? Okay. Now, what is this cell that we are invading? What is a host cell? Which one? What type of cells does HIV go in and infect? No, I know y'all know. How do you diagnose AIDS? Well, hell's bells, CD4 cells. So this host cell is a CD4 cell. Now, if I've stolen all the casino's money, can they stay open? No, they have to close and they die. So that's how HIV keeps going into all these casinos, killing them off, right? So I keep getting richer and richer, more and more diamonds, more and more viral load, fewer and fewer casinos because they have to close every time I hit it. Do y'all understand? That's how HIV will end up taking over the body. Now, how is HIV transmitted? Sex, drugs, blood, and mom to baby. Same as hepatitis B, right? All right, so any sexual contact, sharing needles, if y'all get an accidental needle stick. If you did get an accidental needle stick, what's the very first thing you would do? Wash it with soap and water for like 10 minutes, okay? And then what's the second thing you would do? Report it to the charge nurse, and then she's going to send you to the emergency room where you have to be checked in as a patient. They will draw hepatitis and HIV labs. They will also check the patients, right? Why am I checking labs right now? Did I get HIV in the last 10 minutes? No, I need to see if you don't already had it. So if you try to come sue me later and say, I got a needle stick and I got HIV, I'll be like, you was already positive on that. Do you see what I mean? Yeah, so they need to check everybody's status. Y'all know HIV can take up to 6 months to seroconvert. So you can't just get labs done that day. That's just your baseline to see that you're already negative. You're going to come in at 2 months and 6 months to make sure you haven't seroconverted.
Can you have that work as a nurse?
HIV? Yes, you just have to disclose it to your employer. They have to keep it confidential, but you do have to let them know. Okay. All right, mother to baby, we talked about that. Pregnancy and breastfeeding. HIV is one of the only contraindications in the entire world to breastfeeding. You can breastfeed with literally anything else unless you're taking like, cocaine or something. Don't do that. But like you can pretty much breastfeed with like anything. Okay, you with? Yeah. All right, blood transfusions. Now they screen them for HIV now, but they didn't back in the 1970s and 80s, which is like, what? Y'all didn't think to like, maybe we should make sure it's clean. No, that didn't enter their mind. Sharing personal care items, like it would have to be something where blood was transferred, not like I slept on your pillow. Like that ain't it. It would have to be like razors or toothbrushes, something where like, you see what I mean? Mm-hmm. All right. Do you understand the basic patho? Did we have a good time? Yeah. Cool. That was fun. HIV signs and symptoms and our stages. All right. So once the HIV is in the host cell, what is the host cell? The CD4. What's its job? What does it want to do to your body? It wants to take over. It wants to keep increasing the viral load and decreasing your CD4 count, which will decrease your immunity. Okay. Now, y'all know most of the time HIV starts out with B symptoms. Look at me, notch paper. What are the 5 B symptoms? Sudden unexplained weight loss, night sweats. What was that noise? Okay, when do we see B symptoms or constitutional symptoms? What diseases have B symptoms or constitutional symptoms? Obviously, HIV. No. Yo, this is like, no. Oh, yeah, multiple times. B symptoms are constitutional symptoms. We see them in, I will tell y'all one time, and then I'm going to keep quizzing you on it till you get right. Leukemia, lymphoma, HIV, and there's one from respiratory. No, worse. Y'all don't think these are very bad diseases, obviously. Tuberculosis. Okay. So in the B symptoms are sudden unexplained weight loss, fever of unknown origin, meaning you just have fevers and no other symptoms, lymphadenopathy, fatigue, and night sweats. Those are what we call B symptoms or constitutional symptoms. They are present in which illnesses? Number 1, leukemia, lymphoma, TB. Oh, I wonder what the last one could be. Okay, HIV. Yes. All right. Biggest risk factors for getting HIV. If you're incarcerated, yes, incarceration is a big one because how do I say this delicately?
Don't drop the soap.
Don't drop the soap. The men prefer the men because that's all they have. Yes. So yes, incarceration, there is a high rate of HIV. If you have a mental illness, you are more at risk. And I think that really more is because it may not be forefront on your mind to use protection or to protect yourself, you know. Drug use and also mental illness also goes along with drug use because they self-medicate sometimes, right? Drug use, especially IVs, of course, because they're sharing needles or using dirty needles. If you have multiple sexual partners with high-risk sexual activity, which would be like prostitution, sex workers, yeah. Or, I mean, high-risk sexual activity can even be just having sex without a condom. I don't care how long you've known the person or been married to them. Okay, that's still considered high-risk sexual activity. If you have an STD history, okay, any history of STDs can put you at risk because it can damage the inside of the vagina, which will make you much more likely to get HIV because there is some kind of damage inside of there. Oh, I'm gonna just tell y'all this as an extra fact. This is for the ladies in here, or if you have a lady in your life, sorry, because they do not tell you this at your OB. Do y'all know that every time you get a pap smear, you are not supposed to have sex for 48 hours after? No. Okay, because when they do a pap smear, you know, they scrape you with either plastic or wood, right? And so it has caused a lesion on your cervix. So your likelihood of getting STDs and HPV, which has no symptoms, is so much higher, which makes no sense because you're going to get a pap smear to detect HPV, but you can get HIV, STDs, and HPV are much higher risk because they have injured your cervix. And so now there's just a line in, you know, in order to do that. So I'm just letting y'all know that. They usually, I can't say always, they usually will tell you not to have sex for 24 hours before because they don't want semen in the vaginal canal when they go to do your test. They'll tell you that part, okay, to make it easier for them, but they don't tell you that other part, which is super, really important. All right. There are 3 different stages of HIV. The first one is acute or primary. So what happened when you had sex with somebody who had HIV, they may not even have known it, right? Because you'll know HIV can lie dormant for up to 15 years where you don't even know that you have it, okay? Because in the primary or the acute stage, you get flu-like symptoms, right? Fever, headache, sore throat, fatigue, muscle pain, so you feel like you have the flu. Well, I work at urgent care sometimes because my friend owns one. So if I have a patient that come in and say, hey, I have fever, headache, and cough, I'm not going to be like, you probably got HIV. You see what I mean? So most people do not get diagnosed during this stage. It would be very uncommon. Okay. And then they usually will have B symptoms along with that or constitutional symptoms. Look at me, not your paper. What are the 5 B symptoms? Fatigue, fever of unknown origin. What'd you say? Night sweats, sudden unexplained weight loss, lymphadenopathy. Very good. All right, so at this point, seroconversion will occur. Do y'all know what seroconversion means? What does serum mean? Blood. Conversion. Your blood actually changed to HIV positive, right? But you may or may not test positive at this point, okay? Because sometimes, remember with HIV, it can take up to 6 months for you to seroconvert, okay? My first job as a nurse practitioner was I worked at a child abuse clinic. And so when those kids came in, we would have to test them on that day. That was just baseline. And then 2 months later, they'd have to come back just for blood draw. And then 6 months after that. If after 6 months your HIV and hepatitis are negative, we can pretty much guarantee you're not going to get it because it takes about 6 months, right? 6 months is pretty much the max. All right. So how do we test for this? There is a rapid HIV test. I will tell y'all, we never diagnose off of one positive anything because it's HIV. And that's a very big deal. There's going to be 2. So if you have a rapid HIV, which is very cheap, very easy to get, that's what's in most clinics. If that's positive, you do not tell the person they have HIV because there are false positives, okay? You will tell them, hey, your rapid is positive. You're going to do a follow-up blood test called an ELISA, Okay, it's like a enzyme linked immunoassay or something. And ELISA is not confirmatory either. Okay, if that one is positive, then we send you for what's called a confirmatory Western blot. Okay, now if you don't do a rapid, and a lot of people don't, like if you just go to your doctor's office, they won't do a rapid. They'll start with the ELISA. If the ELISA is positive, they send you for a confirmatory Western blot, but you have to have at least 2 positive tests to say you have HIV. Okay, because that's a lot to put on somebody when you're not sure. All right. Then you go into the second stage, which is called the chronic stage, or sometimes it may be called the latent stage. Okay. They are completely asymptomatic and will stay that way for 10 to 15 years. They could be spreading it to everybody they sleep with and have absolutely no idea if they're not getting tested. That's why it is very important to get HIV tested every single year. Y'all hear me? Okay. HIV is still being transmitted during the stage. You just don't know you have it, which is really scary. Yes. All right. This is just the red stuff at the bottom. These are just notes I'm giving you. You'll know when a patient has HIV, all we use is standard precautions, right? So use gloves whenever you're, messing with blood, wash your hands, yada, yada. You do encourage the patients to notify their partners. You cannot notify them and tell them the person's name. Okay. It is a reportable disease to the CDC. So you do have to call the CDC and say, hey, we have an HIV positive person. But HIPAA rules exist all the way through. I mean, even if the person is dead, HIPAA still is intact. So even if somebody has died, you can't go back and say, oh, by the way, Steve Jobs was HIV positive, which is what they did do that for me. Okay. You have to maintain.
Wait, what?
That was just an example. Okay. Was awkward. All right. Maintain confidentiality. Do we understand? All right, these are other notes I have for you. All TB drugs are liver toxic. So what labs do you need to monitor on these patients? Tell me. ALT, AST, ALK Phos, and bilirubin. Tell the patient to report. If their liver's dead, you're going to tell them to report. What color are they at this point? Okay, so you're going to tell them to report. Jaundice. Good. Y'all are like yellowness. Okay. Med compliance is very, very, very important. And if you look at the risk factors, I forgot to write homelessness too. You can write homelessness. It can be very difficult to maintain medication compliance if somebody doesn't have a home or if you don't have a phone to call. So there are clinics available where you can just go to the clinic, get your medication, and then go about your day. Okay. All right. The third stage is AIDS. What 2 criteria have to be met for you to say a person has AIDS? CD4 less than, they have to be HIV positive. That's fair. They have to have a CD4 count of less than 200 and their viral load has to be increasing, right? Or they have to have the presence of an opportunistic infection. What is an opportunistic infection? Yes. It only affects basically immunocompromised patients. We get exposed to this stuff all the time, but we can fight it off because we have an intact immune system. Okay, so I gave y'all some examples. You're probably going to want to post it to jot down some notes if you don't know what these are. Okay. Okay. What is PCP and PJP?
PCP is a type of pneumonia, right?
Yes, both PCP and PJP are a type of pneumonia. It's like pneumocystis carinii pneumonia, pneumocystis jirovecii pneumonia. You also need to know that those are both opportunistic type of pneumonias. Okay, so those are bacteria that we wouldn't normally get. What is candidiasis? Yeast infection. They usually get it in the mouth. If it's in the mouth, it's called
Oral.
what is oral candidiasis? It's called thrush. What is Kaposi sarcoma? It's an opportunistic cancer. So they will get, yes, very purplish lesions underneath their skin. And it is a cancer. Okay. What is CMV? Cytomegalovirus. It is common in newborns. Okay. And they can't fight it off very well because they don't have an immune system yet, right? When does their immune system kick in? About 1 year of age. Now they will get some from mom, right? You can get from mom and from breast milk, right? But theirs doesn't fully kick in until a year. What is C. diff?
That is a spore-forming pathogen
In the,
Clostridium.
it is Clostridium difficile, and it lives in the
Intestine?
gut. Yep. It's usually from, now we can get it from if we take too many antibiotics, right? But they just get an overgrowth for no reason. What is HSV? Herpes simplex virus. Once you have HIV, you're much more likely to get other STDs, okay, because your immune system is compromised. TB, y'all know HIV and TB go hand in hand. Okay, if you have HIV, a lot of times you have TB because your body can't fight off that bacteria. What is E. coli? Most common bacteria of the gut. What is toxoplasmosis? The only other patient population this is common in is pregnant women. So because it's common in pregnant women, they cannot do this while they are pregnant. Well, that's true, but has something to do with your pets.
Kitty litter.
Kitty litter. Okay, so toxoplasmosis is a something that is found in cat poop.
Yes.
It's like spores that are found in there. So that's why pregnant women are not supposed to change out kitty litter boxes. Yes, they love this kind of stuff. So I want to make sure they all know it. Okay. All right. What is histoplasmosis? No. Histamine. Sorry, histoplasmosis. It's fungal. From bird or bat poop. Bird or bat poop. So if you have like a pet bird or something and you have HIV, you probably should not. Okay. What is this wild for you? Okay. Cryptococcosis. Cryptococcosis. Y'all have heard of something like this? Did you say currency?
That's it. Secretive.
Oh, okay. I see what you're saying. Oh, okay. Hidden. Yeah, hidden or cryptic. I can agree with that. Well, the bird poop is hidden in the soil. So you can get it from bird droppings or it also is in soil.
Is it just like a fungus or?
Yes. It is a fungus found in soil and bird poop. Okay. You with me? It's inhalation of those spores. Like there's fungal spores that are in the soil. That's why HIV patients usually are not supposed to garden. Right? Okay. What is lymphoma? Oh my God. Thank you. Cancer of the lymph nodes. I know sometimes it just takes you a minute, but you always get there. Okay. And then eventually that is going to lead to lipodystrophy. What does lipo mean? Fat. What does dys mean? There's something wrong with. And then what does trophy mean?
Muscle?
Size. Okay. So no, they don't become large. They become nothing. Okay. So their fat completely wastes away. Have y'all seen someone at end stage AIDS? They're emaciated. They weigh like 80 pounds. So lipodystrophy is where they're going to get wasting syndrome, meaning now they have severe diarrhea. They only have 25, 30 bowel movements a day, and they will have lipodystrophy where they completely waste away. Oh, yes, I did see that Matthew McConaughey movie. Oh, it's been a long time. But that's what they look like. They have cachexia where they're like sucked in right here and anorexia.
They have a lot of diarrhea.
Oh, yes, like severe diarrhea. Yes. They usually will end up with cervical cancer. Okay. Because remember, if you have HIV, it puts you at risk of other STDs, and also HPV, and HPV is a leading cause of cervical cancer. Okay. And it could be advanced and it's metastatic. Okay. They usually will die from some type of infection because they have no immune system. There's also something called AIDS-related dementia. And so they will eventually end up going, I don't want to say crazy because that doesn't sound nice. They will get what looks like dementia. They may only be 30 years old. Okay. But it takes over the brain. All right. So most of the time if they have HIV, they'll either die from fluid and electrolyte imbalance or from an infection, or they get so emaciated and so fluid deficient because of the diarrhea. Okay. Do we understand HIV? That's kind of a bummer to end on.
Yeah.
Boom, boom, boom. Sorry.